Well, if you are my age, 50 or older, we have some important health information for you today. It's about the third most common form of cancer, one that men and women are equally at risk of getting, and one that is the second leading cause of cancer-related deaths. Dr. Donald Kim is here to help us better understand colorectal cancer and to talk about some steps we can take to reduce our risk of getting it. And Dr. Kim, I feel like before you leave, I should make an appointment with you because I turned 50 in November. I got my AARP card. I did not get my colonoscopy yet. So let's talk.
Wow, I would have never guessed that.
Really?
But,
well,
that is important. At age 50, that's when you should start screening for colon cancer.
why is that?
Well, everyone is at risk as your body ages. You get certain things, and one of them that we get is colon cancer. And as you said, it is the third leading cause of cancer, second leading cause of cancer-related deaths. And it's important to get screened because it's a test, a colonoscopy that is both diagnostic as well as therapeutic.
Yeah, let's talk about that because as I understand, a colonoscopy enables the doctor to treat some early symptoms of what could develop into colon cancer if left untreated.
Exactly. Over the past 20 years, we've seen a decrease in the cancer-related deaths, which is good news. And when we do the colonoscopy, we can also find the polyp and take care of it. And that's thought to be the precursor or the starting lesion of a colon cancer.
Okay, so who's at risk for colon cancer?
So everyone is at risk. So that's why there's a blanket recommendation at age 50 you should get your colon screened. And then those that have increased risk, obviously people that have had polyps in the past, those with a family history of colon cancer or polyps, patients that are African American, and then also patients with certain conditions like inflammatory bowel disease. So.
Okay, so when we talk about a colonoscopy, it really is a pretty simple procedure, and even the prep for the procedure, as I understand, much different and easier than it ever used to be.
Not sure that's true. I think the prep has been the same, unfortunately, but it's probably not as bad as everyone hears and talks about.
Okay.
The colonoscopy itself is a pretty well-tolerated test, and most people don't even remember that aspect.
You're under a mild form of anesthesia.
Usually some sedation, although there are those that Katie Couric comes to mind that do it without. So
that do it without.
You could do it on TV and all that.
You know what? I'm not sure I'm quite that brave, but let's talk after the show. So what do we do about reducing our risk of colon cancer? Obviously, number one, get that colonoscopy at age 50.
I think what's important, like anything in any cancer-related disease, diet and exercise are really important. Eating lots of fruits and vegetables and reducing your processed foods, red meats, things like that. And then exercise and also smoking. I think smoking alone, if you reduce or stop smoking, that is a big help as well.
Okay, so let's talk about the fact that some people think, well, if I have a family history of colon cancer, I'm at higher risk, or if I don't have a family history, maybe I don't have to worry about it. Everybody's at risk.
Everyone is at risk. Those that have a family history, and it's particular family history, you may in fact have to be screened earlier than age 50. So that's at times important to know, and that your doctor can help you out with.
That's
those
a conversation
questions.
with your primary care physician. Okay, so let's talk about a doctor dialogue series that you have. So you have people invited to come and ask questions and really learn more about this important topic.
Yeah, there's I think it's the 26th of March. We're going to have a doctor dialogue with one of my business partners that is going to go through a lot of that related to colon cancer and screening as well.
Okay, and easy to find. Just register on online. Go to shmg.org/events and register for that. Let's talk about the Irish jig because you guys like to practice what you preach and really raise some funds with an important opportunity, a fun opportunity.
Exactly. It's one of the largest, it's the beginning 5K of the season, and it is March 21st, and not only is it a great event, but there are some fundraising opportunities that are available from local restaurants and businesses in the area that are going to go towards colon cancer research, which is a great cause, obviously.
Yeah, absolutely. And if people are interested in getting in touch with you or your partners to maybe schedule their colonoscopy or get more information, how would they find you?
Well, there's a website that's going to be on the screen, but 616-267-7100 is our number, and we'd be more than happy to steer you in the right direction.
Thank you so much. So don't put it off.
Exactly.
Early detection, the key to survival.
Yep.
Thanks, Dr. Kim. Stay right there, more Bait West when we come back.
Are you West?